it's a big challenge as a small company to commercialize a product. You've got one product, you have to build a team. There are a lot of other things you need to do. What gives you the confidence that Achieve will be able to successfully commercialize cytisinicline if it's approved next year?
Well, I'll start off and then Jamie can add to it. I think one of the key elements of Achieve is the team. The team is dedicated and committed to ensuring that cytisinicline is not only approved, but it's launched successfully, both for cigarette smokers and for vapors. And I think what I've seen is an increasing real commitment to getting this drug approved. So I think having that commitment, having that drive internally to ensure that this is going to be a success is going to be very important to the launch and the availability of the drug going forward. And I think we are actually filling a hole in the market. Smokers today really don't have adequate tools to enable them to quit. Physicians don't have adequate tools to enable them to quit. So we're filling that gap. And I'll now hand it over to Jamie.
So I think the failure rate that we see in small biotech launching products for the first time is because they try to follow a traditional big pharma playbook. And I don't think as a small company you can do that. You just don't have
Sure.
deep enough pockets and enough backup. So if you spend your money too fast and you run out of cash, you don't have another brand to borrow from, and you don't have the infrastructure in place for these large sales forces and lots of access opportunities and contracts that are already negotiated. So we have to think about how we can do it differently, and break the model, and leverage the tools that are available to us now in this digital age, and with all of the technology and marketing infrastructures that are out there. What can we bring into our ecosystem to make smarter decisions faster, and more efficiently, so that we are, when we deploy resources, we will be measuring everything that we do to know if it's working, and if it doesn't work, we can make changes quickly. So we have to be more agile. We have to be more focused, and we cannot just throw everything up against the wall and see what sticks. We really have to be very considerate of what we do at launch and what can wait. And so it's a lot of trade-offs. I've spent time at big pharma and I've spent time with small, and there's a lot of challenges with not being able to do everything you want to do at launch, and it feels uncomfortable, but it's the right way to do things if we want to succeed.